Hey, y'all, welcome to another episode of Confessions of a Male Gynecologist. I'm your illustrious host, Dr. Sean Tassone, America's holistic gynecologist, having some background in integrative medicine, PhD in philosophy. I like to think really, really hard and really, really deep and come up with these amazing answers. Well, most of the time, I just like kind of having fun and helping women feel better, look better, live longer, and basically just get rid of all that dead weight. Today's topic is a little bit deep. It causes a lot of issues in marriages, just life in general. It's a ton of stress. Not something that I have personally experienced in my life, obviously, or even in my married life or my reproductive life have I experienced this, but I wanted to bridge a very sensitive and yet ultimately powerful and important thing in people's lives, and that is fertility. Now, I know that I'm a gynecologist. I don't deliver babies. I haven't delivered babies in probably 6 years. Probably delivered about 5,000 or so in my career. Have 4 kids of my own. I have never experienced, like I said, the trauma, the emotional trauma of fertility or infertility. But I will tell you, I have sat with hundreds and hundreds of women and couples that have experienced this in their lifetime. And the reality is, it really can be a problem. And, the definition of infertility is 12 months of trying without conception. And that can happen to many couples if those same 2 people were to try and conceive over 2 years. The rates go up. So let's say a couple is trying to naturally conceive with no known causes of fertility. The conception rates are about 85%. That means there's about 15% of couples that will experience this fertility definition. If people continue to try for 2 years, the fertility rate goes up to about 90, almost 95%. So it is luckily a rarity, but it does happen. And when it does happen, it can be completely devastating because in many couples, there may not be a cause that is readily discernible. So what I wanted to do was talk about fertility, talk about what we can do for fertility, the fixes, some of them being surgical, some of them being medical, and some of them being integrative, and really just kind of give an overview of this potentially devastating aspect of life, of reproductive life, and what couples can do about it. And the first thing I want to say about fertility is we tend, in my domain, to blame fertility and infertility on female factors. The reality is it's pretty much 50-50. And so we want to look at the male factor as well as the female factor. I think in this culture, we easily blame everything on the woman. We've been doing that for centuries. But the reality is, in this arena, the man does participate. Probably reluctantly for some women, but they do participate. And we want to look at things before we do fertility testing. And I kind of mentioned this at the beginning. We want to look at sexual habits because, when I was in the military, for instance, say there was a couple or a woman that would come in and see a doctor for fertility issues, but the husband was deployed. Maybe they were out in the field. And so the reality was maybe over 12 months, they were only really trying maybe 3 or 4 of those months because they weren't together. So if you feel like you're struggling to have a baby, understand first that there's millions of people, couples around the world that are facing this same challenge. It's a medical term that strikes fear into some couples, but you have unprotected sex for, like I said, about 12 months, and there's no pregnancy. And this is really knowing when you're ovulating and really trying. And obviously, the question that I'll get is, when do you see a doctor? Well, there's no great time to see a doctor. I mean, there's no strict definition. And really, I would kick it back and say, when do you feel like there's a problem? But the medical profession does have some guidelines. If you're over the age of 35 and you've tried to conceive for at least 6 months, if you're simply over the age of 40, you can be evaluated. If you've had no periods, you have irregular or very painful periods, if you have had fertility issues in the past, say you finally did get pregnant and you're trying again and you know that you've had problems in the past, if you know you have endometriosis, or if you have been diagnosed with pelvic inflammatory disease, if you've had more than one miscarriage, if you've had cancer treatments in the past or radiation, mostly to the pelvis, but if you've had radiation in general. Men should talk to a healthcare professional if they know they have a low count of sperm or other problems with sperm that have been diagnosed in the past. If they have a personal history of testicular or prostate problems or problems with their sperm, as I mentioned, if they've had treatment for cancer, such as chemotherapy, if they've had a hernia surgery or they've had a surgery for something that is called a varicocele, where they have varicose veins around the testicles. If their testicles are smaller than what you would think an adult testicle would feel like, or that varicocele where they have varicosities or swollen veins in the scrotum. If they've had fertility issues with a partner in the past, or if they have relatives that have had fertility problems in the past. That's kind of a basic guideline when you can look for help. I will also get then a question for, well, who do I see? This is kind of a hard question because there are a lot of good doctors in there that aren't necessarily fertility specialists, but they know what they're doing. They've treated a lot of women and they're on the internet, and I would endorse some of them. Some of them basically try to just get you back on track with nutrition and maybe weight loss and things like that. They might, but they may not have the depth in certain areas. And so this is the thing. I think for fertility, male or female, you need a team approach. You need some tried and true MDs or DOs that specialize in reproductive endocrinology and fertility. You may need your gynecologist. You may need somebody that is a health coach or acupuncturist, or you just need a team. It takes a village in this case. And I would say fertility treatments are definitely something to seek out a team approach. So when you are worried about fertility issues and you go see the doctor, let's focus on men first. And male fertility relies basically on sperm, healthy sperm in a good number. Obviously, you got to get the sperm in the vagina, and then the sperm have to travel from the vagina into the cervix, up through the uterus, into the tubes. And there's a lot of roadblocks along the ways. So for men, you want to do a really simple semen analysis. And realistically, a semen analysis is like $80 to $90, maybe cheaper. It's usually a masturbatory collection. Most men are pretty good at that and should be able to perform the test. You want to stop sex for maybe a couple of days, and you go in the cup, you bring it to the lab within a few hours, and there you go. You get your numbers. Men can oftentimes have hormone testing. They can do FSH and LH just like women can. They can look at their testosterone levels just like women can. There could be some genetic issues that could cause defects in males. Sometimes a man might have a testicular biopsy to get a small tissue specimen that can look under a microscope. It's a rare test, but it can be done to find out if there's a blockage in the reproductive tract. Most of the time, They don't need to do a biopsy, obviously, but it can be something that's done. Sometimes they'll do imaging, or usually for men, an ultrasound uh, to check blood flow, to make sure that there isn't that varicocele or that collection of blood vessels that it could be warming up the testicles and killing the sperm. And they can also have an MRI done of the brain, possibly to look at a pituitary issue for men. And, we go from there. So for women, we want to look at certain factors, right? So we talked about men. Now let's say we look at the female side of things. Obviously, in order for a woman to get pregnant, we're assuming that you're having sex. And this is talking about heterosexual couples. Obviously, if it's a homosexual couple, for women, they're already going to be probably proceeding to some sort of fertilization method, whether it's in vitro or something along those lines. So I'm talking about heterosexual options at this point. For women, obviously, you have to ovulate. If you're not ovulating, you're not going to get pregnant. So we want to look at ovulation. What can affect ovulation? Well, we know about disorders such as polycystic ovarian syndrome, where women have insulin resistance. They don't ovulate on a regular basis. And if you're ovulating every 3 to 6 months, you don't know when to have sex in order to get pregnant. So at times, this could be a problem, especially if you're trying to get pregnant. So we really want to focus on ovulatory testing. One of the reasons also for irregular periods could be thyroid. And so we want to make sure that there isn't a new diagnosis of, say, Hashimoto's thyroiditis or some other issue that might be causing the fertility issue. With failure to ovulate, obviously, there's also other issues like primary ovarian insufficiency, or what we used to call premature ovarian failure. This can be caused by some of the issues that I just mentioned in the past, like chemotherapy or radiation or genetics. And sometimes we don't think about it, but aging used to be, when I was really young, that 35, most women were probably well on their way of having a family by then, and we're trying. 35 now is when some women are starting, actually a lot of women, because they're focusing on careers and they've got other things going on. So times have changed, and we want to look at age because age can add to diminished ovarian reserve, which means that there might be a lower number of eggs in the body. And there is this thing going around right now. It used to be taught that a woman has the number of eggs that she is born with, and you don't make any more. There's a lot of people in the alternative community that are saying this isn't true. It is true. A woman has the number of eggs that she's ever going to have when she's born. You don't make more eggs. That's not a thing. It's not like the males where you make sperm on a daily basis. So let's debunk that myth right now. You recruit different numbers of eggs as you go through your cycles. You could recruit less or you could recruit more, but it's not like your body just makes more potential follicles or eggs when you're 45. You are born with those eggs. And the reason that we see more miscarriages and more genetic malformations as a woman ages is because the fact that those eggs are older. As you age, the DNA in those eggs is now 38 or 45. So these people that believe that you make more eggs as you age, it's totally contradictory to the data that we have, because that would mean that the egg would be brand new and there wouldn't be an increased risk of genetic malformation or miscarriage as you age. And we know that happens. So listen, flat earth people, get your data from actual data sources. You are born with the number of eggs that you're going to have for the rest of your life. Done. Let's not even talk about that anymore. There, as I talked, endocrine disorders such as thyroid, hypothalamus, that can affect your hormones, and then lifestyle and environmental factors. We look at obesity, we look at polycystic ovarian syndrome. Sometimes just losing 5% body weight greatly improves the likelihood of ovulation and pregnancy. Being underweight is linked to ovarian dysfunction. Women that go through strenuous or physical labor, taking certain medications, too much exercise, sometimes can hurt. Like, long distance runners or track and field women have issues where they're not ovulating as much. Substance usage, like smoking tobacco, marijuana, heavy drinking, illegal drugs, heroin, cocaine, things like that. Having super high blood pressure. For men, certain types of underwear, riding bicycles. If you ride bikes a lot, because the testicles are so close to the body, they can increase body temperature. And we already talked about radiation and chemotherapy a couple of times. So that's what can affect failure to ovulate in women. Problems with the menstrual cycle, that obviously is part of that ovulation. And it makes perfect sense that if you're not ovulating, you're going to have a lower risk of obviously getting pregnant. So structural problems of the reproductive system. So the sperm has to go from the vagina into the cervix, into the uterus, into the tubes, and then ultimately meet the egg. What can affect that transit time? Well, let's say you have a cervical anomaly. Let's say you have a uterine anomaly or a fallopian tube anomaly, Mullerian tract anomalies. Mullerian refers to the female reproductive tract. So there's a lot of things that can happen. Let's start at the cervix. It's possible for a woman to have antibodies actually to male sperm. And this is called cervical factor. They will do a test where it's called a postcoital test, where you have sex, you go to the doctor's office within a few hours, they will get some cervical mucus, they'll put it on a slide, and they'll see how many sperm are alive. If they're all dead, it's possible that you could have an antibody. And so they'll want to bypass the cervix. You could have scarring of the cervix. If you've had abnormal pap smears in the past and you've had a test called a LEAP procedure or a loop excision procedure of the cervix, where we're actually cutting tissue out of the cervix, when that heals, you could have scarring of the endocervical canal that leads into the uterus. And if the entryway is scarred shut, sperm can't get in there, even though they're super tiny. Now, usually that doesn't happen to the woman that has had one of those procedures done over her lifetime. But if she's had a couple done, it could certainly be a factor. Uterine fibroids, or we've talked about those in the past, those muscular knots that appear on the wall of the uterus, they can happen in the cervix. Most women with fibroids don't have fertility issues and can get pregnant just fine. However, it can add to fertility and certainly miscarriage and preterm labor because of where they're located in the body. Polyps, which are non-cancerous growths on the inside of the uterus. Polyps can interfere with the function of the uterus and make it difficult for a woman to remain pregnant. May not add to fertility issues, but it's possible. Certain surgeries in the uterus, hysteroscopies, dilation and curettage, where we're scraping the lining, can cause scarring of the uterine lining, called Asherman syndrome, which could interfere with implantation. Again, under sterile conditions and in the way that we usually do things, and that's not going to be a problem, but it's always possible. The other thing is tubal factor fertility. So if the tubes are not open, that sperm can't get to the egg. The number one reason for tubal damage is endometriosis. Undiagnosed endometriosis can cause inflammation in the pelvis. Another reason would be infections, and we'll talk about infections in a minute. Basically, where you have what we STDs. I mean, you could have E. coli or something that wouldn't necessarily be a sexually transmitted disease, but you could still have infections that could get in there and cause problems. Now, usually, you're not going to have a horrible infection and not know it. I mean, you would have pelvic pain and fever and things like that. But untreated gonorrhea and chlamydia are the leading causes of what's called pelvic inflammatory disease, and that can block your fallopian tubes. Now, I will tell you, in my career of over 20 years, I have maybe seen true pelvic inflammatory disease less than 5 times. Women are diagnosed with possible PID when they go to the ER all the time. And I don't know why. I think it's unfortunate, but it's usually not pelvic inflammatory disease. Untreated syphilis can also cause a problem. I've seen maybe 2 cases of syphilis in my career. Very, very unlikely, but more reasons to think about using condoms and things like that. So think about that. There's also a possibility in women that eggs may just not mature very well. This can be from, like we talked about, polycystic ovarian disease, implantation failure, where the egg does get fertilized. The sperm goes up into the fallopian tube, fertilizes the egg comes down, and then there can't be implantation. Sometimes you will hear of something called chemical pregnancies, where you have the chemicals in your body, HCG, human chorionic gonadotropin, and it just doesn't grow into an embryo. The lining of the uterus can be too thin because of progesterone issues. There can be, again, endometriosis. Some women have issues, as I said, with progesterone or scar tissue in the cavity. Well, let's talk about endometriosis really quick. I've done some episodes on endo. We had endometriosis month a few months back. Endometriosis is very unfortunate. And I say that because most women are made to suffer with endometriosis for maybe even 7-8 years before they're diagnosed. And that's because doctors just put them on birth control pills, or they kick them down the road to somebody else, and it takes years and years for diagnosis. And over the years, the endometriosis can change and develop more depth, more lesions, and more inflammation and more inflammation. Research has found a link between, obviously, infertility and endometriosis. And studies have shown that between 25 and 50% of infertile women have endometriosis, and between 30 and 40% of women with endometriosis are infertile. We don't know the exact reason. Obviously, there's direct tubal damage. There's also the possibility that the increased inflammation in the pelvis can slow down tubal transit. There's little hairs on the inside of the fallopian tubes called cilia, and they move and they create a little current inside the fallopian tube, which pulls the egg down towards the uterus. If there's inflammation in the body, then those cilia can be damaged and they don't move the egg through, thus causing not only infertility, but if you did get pregnant, can increase the risks of ectopic pregnancy, where the pregnancy, the embryo implants in the tube, and that could be a surgical emergency. Polycystic ovarian syndrome, briefly, done a lot of episodes on that if you want to go back and listen to those. PCOS is probably one of the most common causes of female infertility. As I've said in the past, there are so many women that are diagnosed with it that don't actually have it, and there's a lot of women that have it that aren't diagnosed with it. Basically, the ovaries, in some cases, the adrenal glands produce more androgens than normal. High levels of androgens interfere with development of the ovarian follicles, and thus they don't release eggs, and the fertility rates go way down because you don't have obvious ovulation. Also, we see a mix-up in the FSH and LH ratios that are coming from the pituitary gland, and you need those ratios to be in a dominant FSH state so that the LH surge, when that happens, it causes you to ovulate. The problem is with women in PCOS, the LH is high and the FSH is low, so those follicles never really develop. Current research is showing that probably 10, maybe 10 to 15% of women in the United States have polycystic ovarian syndrome. Premature ovarian insufficiency, women don't ovulate because the ovaries just aren't working and you have troubles getting pregnant. This can also affect your hormones. Very, very rare cause. And obviously autoimmune disorders. Autoimmune disorders can affect fertility because it's taking away from your body's ability to naturally ovulate. I've often said the reproductive system, the sex hormones and things like that, it's a very intricate system. It takes a lot of energy to run that system. And with the exception of thyroid and cortisol from the adrenal gland, you don't need estrogen, progesterone, testosterone, DHEA to live. And so, because it's such an intricate process and it's not necessarily needed for life, and your body's got to run its gut, it's got to digest food, it's got to run the heart, got to run the brain. If it's in a stressful situation, like working out too much, having sicknesses and other things like autoimmune disorders, it shuts that system down because it needs to do other things. So autoimmune disease is basically the body thinking that something that's supposed to be there isn't supposed to be there. So let's take, for instance, Hashimoto's thyroiditis. Your body makes antibodies to your own thyroid gland, thinking that your thyroid gland is a foreign invader. And over time, starts to attack it. You start losing thyroid gland tissue. The hormones get all out of whack, and it really can cause issues with ovulation. But things like lupus, rheumatoid arthritis, Sjogren's syndrome, Crest syndrome, all of these things that are causing autoimmune disease in women. And we think to a certain degree, there might be women that have issues with, what am I trying to say? Issues with endometriosis that it may have an autoimmune component. So there's all kinds of testing that you can have done. And where you have that testing done is totally up to you. I would say if you're doing a fertility workup, there's some easy tests you can do. Ultrasound, you want to look at the ovaries, you want to look at the uterus. You could do thyroid function testing, hormone testing, estrogen, progesterone, testosterone. You could do anti-Mullerian hormone if you're wanting to look at egg quality and ovarian reserve testing. You could do what's called a hysterosalpingogram. Hysterosalpingogram is where you go to the radiologist. They put you on a table. They inject dye into the cervix under a real-time live ultrasound or X-ray, and you see the uterus fill up with the dye, and then you watch the dye spill out the tubes to just check to see if the tubes are open, see if there's a cavity issue. You could do hysteroscopy, where you put a camera in the uterus and look around to make sure there's nothing going on. And you could eventually also do laparoscopy, where we use little cameras and we look for endometriosis. So you can see there are things that you can do. There's many tests you can do, but you don't have to. You can try to get pregnant on your own. And really, I believe that stress is a huge factor. It's a huge factor. The more that you stress about it, the more that it taxes your body and can affect your ovulation. Now, easy for me to say, I've never experienced it. And I would hope that we're not just telling you to go, not stress out. But we know that women and couples that are suffering from infertility issues, 80+% of those couples report using at least one form of integrative medicine modalities to treat their infertility. About 40% report using acupuncture, almost 30% yoga, 25% massage, 20% meditation, and about 20% also use what they call supplement treatment. And I'd like to talk about some of these because I think, well, that's probably why some of you listen to me, is because of that. So looking at the possibilities and things that you can try, we know that there are lifestyle changes that need to happen. And I would always talk about lifestyle changes first with a couple. I think, it's the hardest one to talk about because that's the one that's probably going to take the most work. So we want to look at, not drinking alcohol, smoking, caffeine intake, red meats and vegetables. You want to eat more organic foods, leafy greens. I'm a big fan of maca. Obviously, I talk about it all the time. Good fats, good nuts and seeds. And you want to maybe try to stay away from sugar and things that are inflammatory like gluten and dairy. You don't necessarily need them. So we talk about lifestyle changes. There are some people that will rely on religious methods and prayer and things like that. So there's definitely no right or wrong way to do this. But let's just say that people that get to this point start becoming a little bit desperate, because reproduction is kind of human. I mean, obviously, or we wouldn't be here. And we somewhat look at this as a possible, oh, you're fine, don't worry about it. It's hard to say that to somebody when you don't know what they're going through. So I want to talk to you about the treatments. I'm not going to go into things like IVF and inseminations and stuff like that, because that's something that you can look at on your own. But I wanted to talk about things that you can maybe do. Like we talked about ovulatory dysfunction. We talked about stress and over exercising and potential toxin exposures and maybe autoimmune diseases and things like that. So I think that you should start with a hormone analysis: FSH, LH, testosterone, estrogen, progesterone, thyroid, a full panel with antibodies. We might want to look at insulin and glucose levels. Just to start. I don't think you need to necessarily go into crazy stuff like mold and Epstein-Barr and all that. I know that some of the alternative therapy people will go into all that. I don't think you need to necessarily do that, but that's up to you. You can look at vitamin D, vitamin B12, B6. I did say glucose. I think that's a good marker. You could look at cortisol levels. We've talked about cortisol in the past. In order to check cortisol, you either have to use saliva or urine testing, because those are the only good ways to actually look at things. So let's talk about what you can do on the side of maybe a spiritual practice, hearkening back to this Shines protocol that I talk about. Well, I think the spiritual practice for you needs to focus on what you think works. Spiritual practices, I'm not going to tell somebody, oh, go pray if you're an atheist, right? But spiritual practices span a spectrum. You could pray if that's something that really resonates with you. To me, prayer is contemplative meditation. You are focused. You have a thought process in mind. You are giving your plan over to a power higher than you, and you're asking for help. A spiritual practice could be journaling. It could be meditation, yoga. We talked about, how people are trying those things. So those are things that you can do. You can journal, you can read a book, you can search out support from other support groups out there. There's tons and tons of fertility support groups. You also could look at the hormones. Now, the hormones are a big piece, and I talked about the panel a minute ago. Obviously, you want to focus on ovulation. You want to focus on good progesterone production. You want to look at thyroid and not just the TSH, because that's not going to tell you everything. You want to look at antibodies. We talked about the energetic aspects of all of this, the stress that causes. I think acupuncture is probably the one alternative modality that has the most data to date, and it actually has been shown to help. If you, and I can't tell you why, I don't know why. I think a part of me thinks that, okay, you're going into this nice, relaxing environment, and they're putting needles in you, which could be stressful for some folks, but then what do? You lay on a table for 45 minutes and you zone out. That's very relaxing. Take away the potential energetic blockages and things that the Chinese medicine docs know about. I don't pretend to know about that. And what they're working on there. Just laying down for 45 minutes a week and taking a load off and relaxing and breathing and allowing somebody to take care of you is extremely powerful. Nutrition. We talked about, good protein intake. I think women are horribly under proteinized, if that's a word. You want to focus on maybe 1 gram per pound of body weight, or maybe muscle density, so looking at if you're 150 pounds, trying to get in at least 120 grams protein. Most women are probably getting a third of that. You want to eat super good fats. Good fats are what your hormones are made from. Cholesterol, you need cholesterol. It's what the hormones are made from. So don't go on a low fat diet. You need fat. Just make it good fat. I'm not a carnivore and I'm not a vegan. I think a good blend of good, healthy, lean meats and vegetables and fruits. I would stay away from processed foods. I would stay away from gluten and dairy because they can be inflammatory and you don't need the added inflammation in your body. I think that's a good place to start. Exercise. I wouldn't exercise. I wouldn't over exercise. There's a lot of data coming out that shows walking for an hour a day can be just as beneficial as running. It may not give you a body shape that you want it, but it's going to burn calories. It's going to give you benefits. It's going to help you sleep. Sleep is enormous. You need to sleep to ovulate regularly. You need to sleep to have your cortisol levels in check. So I would definitely stress the importance of good sleep, good foods, and lowering the inflammation in your body. I wouldn't worry about counting calories. I wouldn't worry about overeating. Also, if you feel like you might be overweight, then seek out the help of a physician that can help get you into that right weight zone for you. I'm not a big fan of the BMI because just like the food pyramid, I don't think it's based on the greatest data. And what's right for one may not be right for another. And I just hate that guideline. What I really wanted to focus on at the close here is supplements. I get asked this question all the time. There is a company that I'm a big fan of called Needed, and their website is thisisneeded.com. And the reason I like them is because they were formed out of this need. They had a need. There were trained nutritionists and mothers themselves, and many of them had tons of deficiencies. They dug into the research. They found that 95% of women in the country were taking prenatal supplements when they were trying to get pregnant, and yet 95% were still deficient in key nutrients. So they wanted to dig into that more. They found that most of the supplements on the market were only meeting bare essentials, like bare minimum needs. Most prenatal vitamins leave things out like omega-3s, choline, vitamin D, calcium, magnesium, and they include, or if they did, they included dosages that were way too low. Prenatal nutrition in and of itself, they were having hard times finding trusted fundamental nutrition information, and most of the time, the information they found was incomplete. And so they wanted to go forward and set a new standard. And so they did it. And these are two women that just did this. They got experts to come in from diverse backgrounds, OBGYNs, midwives, dietitians, herbalists, functional medicine doctors. This is how it should work, people. These ladies did what should work. So what do you do for supplements? And the other thing is, I think the problem is a lot of y'all are having to go out there and pick and choose. Well, let's not do that. What you want to do is you want to get, like I talked about, good protein. You want to be on a pre and a probiotic, a good omega-3 and CoQ10, which I'll talk about, and you want to support egg quality. So collagen proteins, how would it, what is that? What does that even mean? Well, it's protein. Most women aren't meeting their protein needs just in general, but then let alone pre-pregnancy and pregnancy. So you need more prenatal protein. You need protein to support healthy blood sugars, minimize nausea when you do get pregnant, and obviously help the baby grow when you do get pregnant. But collagen is the basis for all proteins. Collagen is an optimal form of all this. It supports your joints, pelvic floor, your skin elasticity, and even postpartum will help with hair and things like that. So you'll want to get your protein levels up. And I think you should start, my belief would be to start with a really good, solid collagen protein. Then let's look at gut, because we know the hormones. There is something in your gut called the estrobolome, which helps the hormones. We don't know the exact science yet because it's actually quite new, but you want a prebiotic and a probiotic that's going to support your vaginal balance, your digestive comfort, your iron absorption, and you really want to get your microbiome in shape. A strong, healthy microbiome in the digestive tract, skin, and the vagina, obviously, is needed for you to be pregnant and to support a pregnancy and to get the baby on the right path. So you want to include polyphenols, and I'll go into some of the ingredients that I think are super important. But let's just say collagen protein, a good probiotic. Omega-3 is essential. I mean, come on, right? And you can do a fish oil. You can do I talk about Orlo Nutrition. They have a great omega-3. It's algae-based for those of you that don't like to maybe talk about or don't like the idea of fish because it gives you the burps. But you want to be on a good omega-3 that's DHA and EPA, choline, lutein, and zeaxanthins. These are nutrients that work basically together to support optimal egg health. So let me say that again. Omega-3s with DHEA and EPA, choline, which is an amino acid, lutein, which is in like tomatoes, and zeaxanthin. These really work to help the brain. It helps egg health. It helps your nerves and your eyes. And so you'll want to have a product that has those. Like I said, you can look for a fish oil. You can go with Orlo. You can go with a combo product. CoQ10. CoQ10 is essential for supporting egg and sperm quality. It's also good for your cardiovascular health and metabolism, especially if you're a woman that may be on a statin because your cholesterol was high. You're going to be depleted in CoQ10. It's an antioxidant that's found in basically every cell in your body, and it's needed in the preconception phase. You have to have it in good levels to support egg and sperm quality. It also supports your mitochondria, and we know that mitochondrial support is super important for women to sorry, my dad was calling me right there, talking about parenting and getting pregnant. My dad is checking in. I'll call him when we're done. So CoQ10, and then finally a good egg quality. Another product that I found with this company needed is they have a good product that also supports mitochondria and oxidative stress, because we're dealing with that all the time. That's your DNA. That's getting rid of the toxins in your body. That's oxidative stress from aging. And so let's really quick just talk about some of the ingredients that I think would be great. Acetylcarnitine, green tea is a great antioxidant, and PQQ, pyrroloquinone, quinone, try to say that fast, and then alpha lipoic acid. Those three things are really powerful antioxidants. You want to get as much of those as you can. A good collagen protein, a pre and probiotic, a good omega-3, and some CoQ10. Now, I will tell you that I reached out to Needed because they really focus on women's health. And rarely, if ever, have I found one company where that's basically all they do. And they were founded by women. They are owned by women. And I really want to support these women. So I have a great relationship with this company Needed. If you are struggling with fertility and you're patching all these supplements together, I'd really love for you to look at their website, thisisneeded.com. You can use code Dr. T DRT. I'm not getting any kickback from the supplement sales for transparency, and I will be having them on an episode so that we can talk to them. I think it's Stephanie is going to be coming on, and we'll be talking to her. So fertility, lots of things out there, lots of information. This was just kind of a quick beginner's guide. I would encourage any of you that are thinking about prenatal vitamins. What do I take? I get women all the time that will come in to see me, and they're trying to maximize their health and their support and their hormones. I would look at the fertility support plan that thisisneeded.com has. They have a they have the collagen protein, the pre and probiotic, the omega-3s, the egg quality sport, and the CoQ10. You'll get a discount by using code Dr. T. I look forward to seeing y'all on Saturdays on my Instagram at SeanTassoneMD, where I answer questions all Saturday. Check in on my Instagram daily. I'm doing little morning tidbits to kind of get y'all up and at 'em. And I wish you all the best. The holiday seasons are coming. We're already into November. Oh my God. Let's talk about Thanksgiving in the coming future. And I got to start buying some Christmas presents. Dang, it's coming quick. Have a good one, y'all.